The national debate over cost of care lands in Colorado's capital.
I am afraid to even go to the doctor, just afraid of the price.
Will a public option for health insurance save you money, or is it just a proposal with no chance of passing?
Where's the money going to come from?
Denver 7 is going 360.
This is a sign of a damaged system. 33% of Americans are extremely worried about getting seriously ill. 40% are extremely worried about how they'd pay for it if they wound up at the hospital. The high cost of care is a known issue. Leading Democrats said today that a public option is part of the solution.
And the public option is a state-run insurance plan that you can buy instead of using your company insurance or buying it from the marketplace. Similar to Medicare for all. Democrats say it'll be cheaper than what we're currently doing.
Now, Republicans have flashbacks to the Obamacare fight in 2009, when then President Obama famously said, if you like your doctor, you can keep your doctor, and that did not prove to be true for everyone.
So in tonight's 360 report, we'll bring you both parties' view on lowering health care costs. We'll also show you how the public option has worked in other states and break down why insurance companies are going to fight so hard against it. Denver 7's Russell Haythorne leads us off.
Hello, everyone, and thank you for joining us here today.
Democratic lawmakers on a Zoom call today rolling out a proposed state-run public health care option.
Coloradans are ready for a new day in our state.
During that Zoom, several Coloradans, like teacher Noel Emerson, sharing their hardships. She says she often puts off investments at the expense of high health care.
I have also decided not to invest in my future with wanting to buy a house, with wanting to save money, or even take care of my student loans. I can't afford that as an educator because my deductible is extremely too high.
Nearly 1/4 of my income.
Stephanie Salazar recently lost her employer-sponsored insurance and now pays more than $1,000 a month for health insurance.
This puts me in a very difficult financial situations and means I must make some trade-offs. Between the cost of my mortgage and my health insurance, I expend 60% of my monthly income.
The new public option has two phases. The first phase would attempt to drive down healthcare costs, with insurance companies offering standardized plans across every zip code. If the healthcare industry fails to meet phase 1 goals, the state would launch phase 2, a state-offered health insurance option.
This isn't about imposing government mandates on the industry or forcing anyone to give up health care that they already have and like.
But it faces a wall of opposition from private insurers, hospitals, and conservatives.
This is not good for Colorado.
It sets us up for failure.
Some argue this bill forces doctors and hospitals to provide care at low state-mandated prices, which could potentially lower quality of care and put some rural hospitals out of business.
With these rural communities, I mean, they already have to drive an hour or so to a hospital.
Senate Republican spokesman Sage Nauman says this bill is even worse than the one that failed last year.
Last year's version said, if you're a hospital or a doctor who decides to not accept a public option patient, we're going to fine you. This year, they're threatening to take away their licenses.
The Colorado Hospital Association says while the first phase is workable,
At least it includes a market-based initiative on the front end.
the second phase is no good.
The second phase of this, the kind of true Colorado option piece, as it's currently drafted, just goes way too far.
Russell Haythorne, Denver 7.
And if hospitals decide to hold their ground under a public option, it could get expensive for consumers. We've already seen this play out in Colorado. UC Health is not considered an in-network provider for any of the Denver metro counties on the state marketplace right now after contract negotiations fell through last year. Patients who saw UC Health doctors before this year must find new care or pay out of network prices. And the big question is, how many people would actually use a public option? More than half the state gets insurance through their job. Only 7% is buying through the Affordable Care Act marketplace.
We've already seen one example in Washington State, which launched a public option last year. The premium you pay for a public option plan in Washington isn't much different than what you'd pay for the plans offered by private insurers. In fact, in many counties, the public plan is more expensive. Washington's program did make things less expensive. The average insurance premium, 2% cheaper this year. But officials were hoping for a more significant impact than that. And here in Colorado, Democrats say they are hoping to reduce premiums by 20% over the next 2 years.
We are breaking down this proposed law in much greater detail on thedenverchannel.com, and you can check that out right now. We'd also like to hear from you about this very meaty subject. Email your thoughts to 360@thedenverchannel.com.